Pop quiz number 32. In the early stage of shock, the nurse would expect the result of the ABG analysis to indicate 1. Respiratory alkalosis, 2. Respiratory acidosis, 3. Metabolic alkalosis, or 4. Metabolic acidosis. What do you think? And guys, the correct answer is 1. Respiratory alkalosis. Let me explain this to you. In the early stages of shock, the organs are just not figuring out something's wrong. We're not getting enough perfusion. Time for us to shut down. The body tries to compensate. How does it try to compensate from lack of circulating blood? Remember, blood's carrying the oxygen. So how does the body try to compensate? By hyperventilation. The patient will start going like this. They start hyperventilating because they're trying to get oxygen to perfuse the tissues. This can only work for so long, guys. It only works for a short amount of time. So for that short amount of time, even though that oxygen... For a short amount of time, even though that oxygen may be normal, you're going to see the CO2 decrease because of the hyperventilation, then blowing off all of that CO2. And that's what you expect to see in the early stages of shock. By the way, if you're ever asked which organ which organ shuts down first during shock, it's going to be the kidneys.